FUE has become one of the most popular hair transplant procedures. But is it the best option for you? Dr. Stephen Walker breaks down how FUE works, how it differs from FUT, and what every patient should know before deciding.
I am Dr. Stephen Walker. I'm a surgeon. I am specialized in hair restoration surgery and aesthetic medicine. I have more than 7 years working in hair restoration surgery and aesthetic fields. And I have been working in a lot of countries like Colombia, Mexico, USA, and currently in Spain. I did my college in Caldas University in Colombia, and I did my specialization in Mexico, and I did a master's degree in Spain. FUE, follicular unit extraction, is an individual hair follicular extractor for the donor area using a small punch. That's the technique. It's just a technique of extraction. Extract follicle per follicle with a punch, making an incision around the follicle to extract one by one. To perform this procedure or this technique, we use a small circular punch to cut around the follicle unit and extract hair by hair, or follicular hair follicle by hair follicle. Okay, but we use just is a circular punch. It's a really small. So FUT is the difference between FUT and FUE is that FUT, it consists to taking a strip of the skin from the donor area, usually the back or sides of the scalp, and the hair follicle are extracted and separated for the strip. Under the microscope, we cut every follicle, right? But we have just taken a strip of the skin, right? And the FUE, we have to cut and make an incision around every follicle to be extracted. The preparation before surgery, FUE or FUT is the same. Okay, so first we recommend to the patients to avoid alcoholic or energy drinks, except coffee or tea, 24 hours before surgery because of the blood pressure and heart rate. On the day of the surgery, we recommend eating a light breakfast and arriving at the clinic early. There, a pre-surgical consultation will be held with a surgeon. The area to be grafted will be confirmed and design will be performed if necessary. In the cases, we will restore the frontal area. The patient will sign the informed consent form for the surgery, followed by pre-surgical photograph and hair shaving. The patient will be taken to the operating room. Then the anesthesia will begin. In the cases, in the donor area, we will start for the extraction. After that, the follicle unit extraction, the incisions are made, and finally, the grafts are placed in the incisions. And at the end of the surgery, the patient will be given further post-operative care recommendations. And as all in FUE, FUT is the same. Only part we change is in the extraction part. We don't perform this kind of surgery. It's not common perform this kind of surgery. It was the first surgery performed in the history, right? But with the advance of technology, right now we are performing less invasive surgeries like FUE because of this cutting. With the FUT, you will have a big scar. It's a large scalp in the back of the head or the sides. So it could be covered with the surrounding hair, but the patient will have a really linear scarring for all your life, right? But with FUE, the scarring is minimal, just a circular point of scarring of the scalp. So if you in the future after the surgery shave your head, it's not visible directly. So because there are just points of scanning, is more aesthetical result compared to the FUT, when you can see if the patient shave the donor area, will appear the scarring, the line, and is large. The ideal patient for surgery is one with androgenetic alopecia, stabilized with medical treatment. And the lower the degree of the alopecia, the better. It is also important to have a good donor site, right? Patients who are not susceptible for surgery are those whose expectation do not match the possibility, or those with scarring alopecia without medical treatment. It'll depend of every patient, but it will take approximately 12 months to see definitive results, but significant results could be observed after the first 6 months. In 6 months, you can see, and wow, it's going well, but the final result, it will take almost 12 months. In the cases of the crown, it will take more time, maybe 18 months. I will advise them to have surgery and start medical treatment as soon as possible to prevent the alopecia from progressing and achieve the better results. That's what I will advise to patients. Because if you are worried about alopecia or losing hair, is the moment to do something, to act. A lot of patients just wait on time, but when they decide to do something, and sometimes it's really late and we cannot do nothing, not treatment or surgery, right? So I think the best advice to these patients are do it now, treatment and the surgery, or both, to stop progressing of alopecia.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.